Hello everyone, here we are in our OPD with this patient who has stayed with us for over 10 days and today he's all set to go home. Now the reason he stayed longer is because we've done multiple procedures, we've done a rhinoplasty. He had a severe facial asymmetry and the swelling still exists, although this also looks like an asymmetry, but this is going to go down because, and we know that because on table we have achieved really good results for him. He was on anti-inflammatories for a couple of days. थोड़ा बस. इतना दर्द हो रहा है?
मुझे दर्द होता है.
आपको बहुत दर्द होता है? इतना बड़ा सर्जरी किया. सर्जरी के बाद दर्द था आपको?
नहीं.
सर्जरी के बाद दर्द नहीं था. ये ज़्यादा दर्द हो रहा है.
इसका तो और भी ज़्यादा लग रहा है दर्द.
Yes, so this procedure of taking off splint is more painful than the surgery, that's what he says, and the reason for it is okay, धीरे से करूँगी, ठीक है?
हम इधर से उठा लो पहले.
जल्दी कर देती हूँ तो कम दर्द होएगा.
मैडम आप तो कम कर दो.
हो गया. So the procedures performed for him were basically to correct the facial asymmetry. He's still in pain from the dynaplast removal. So as you see in the pre-op images, he had asymmetry on the right side. It's still swollen, as I said earlier, because of the amount of bony work done here on the malar region. Also, we have contoured the entire lateral dorsal region. That's why a nasal splint was kept, not exactly a rhinoplasty, just the lateral dorsal region has been corrected. Then the genium, the chin, you see he had a very broad chin. We have corrected the chin also, brought it forward, augmented it both in the horizontal and the vertical dimension, and it is along with the angle region. So we have worked on chin, nose and the malar bone. आपका एक्सपीरियंस कैसा था यहाँ पे?
बढ़िया.
बढ़िया था. मज़ा आया आपको? दर्द कितना था?
मैम दर्द नहीं था.
बिल्कुल नहीं.
बस अभी छुटाने में दर्द हुआ.
आज ही दर्द हुआ पहली बार. सर्जरी के बाद पहले दिन?
नहीं, हल्का थोड़ा बहुत.
थोड़ा सा. और आप अभी खाना सॉफ्ट डाइट स्टार्ट किया आपने?
जी.
कितने दिन से स्टार्ट किया था आपने?
3 days.
3 days बाद से?
जी.
Okay. All right, so we'll just clean him up, send this patient. We'll remove all these sutures up. If you see the lateral view also, थोड़ा ऐसे देखो. Stop.